As periodontists, we like to keep teeth whenever we can, but there's certain situations when a tooth is hopeless. It's cracked, it's hurting, there's infection. Unfortunately, there's times that teeth have to be taken out. And when they do, we like to take them out in a way that's as painless as possible. It's not a fun experience for anybody, but we want to set the patient up for success moving forward to get them back into good health, good function, and have good cosmetics. So one thing that we do when we take teeth out is do it in a very special way. We take our time with taking teeth out. We do different procedures a little bit differently than have been done in the past, with care to preserve as much of the jawbone structure as we can. A lot of time this even means bone grafting when we take teeth out to help preserve the jawbone. That's something that we really focus on, is making our procedures as comfortable as possible, but also speeding the recovery as well.